Let's get now to your eye on health. October is Breast Cancer Awareness Month, of course. We can never talk enough about this. And tonight we really want to focus on a medical expert, a conversation with them from Baylor Scott & White to talk about technology and the advancements that is affording us in early detection. So tonight we've got Dr. Jennifer Morera. Thanks for being with us tonight.
Thank you for having me.
First thing I want to ask, because this is, I think, a highly debated topic, right? The age that women should start having mammograms, because there are some addendums to that age that we all know, which is 40 for the most part.
Yeah. So we recommend to start breast cancer screening at the age of 40. And this recommendation is now both from the U.S. Preventative Task Force and also from the American College of Obstetricians and Gynecologists. So we recommend to screen from the age 40 to 74. And then after the age of 74, we recommend you talk to your provider to discuss whether or not you need to continue that screening.
Now, are there some exceptions where someone may have family history of breast cancer, dense breast tissue, things like that, that could say, hey, I may want, just for my own sanity, a mammogram before the 40?
Yeah, okay. And definitely that is very much patient dependent. And this is where it's so important to have a good relationship with your provider. If you have a strong family history, for example, strong family history means breast cancer in a first degree relative, first degree being mother, sibling, or even child, that increases your risk right there. And we have tools that we can use to calculate whether or not you are considered high risk. And something to be aware of, Baylor Scott & White, we actually have a high risk breast cancer clinic. So if we determine that you are high risk, we can go ahead and place a referral for our patients, have them go to this high risk clinic, and there they get a one-on-one visit where they get to determine, okay, what additional testing can we do for you? Is it MRI? Is it ultrasound, genetic testing? And if you are deemed to be high risk, they can help set up that process to help prevent breast cancer.
Because mammograms really are the starting point, right?
Yes.
There are so many other ways that we can determine and detect cancer. And that's the beautiful thing about technology. We know there's been a lot of advancements when it comes to detecting this. Can you share the new guidelines for that technology in early detecting?
Yeah, so personally speaking, for all my patients, when it comes to breast cancer screening, I will order the 3D mammogram. So 3D mammography is one of the new imaging modalities we have for our patients. And the big difference between 3D and our traditional is that 3D will capture multiple images of the breast. So then with those images, we can reconstruct this 3D image to get a better look at those abnormalities, if there is one. And then also it's a really good way to check for breast cancer in our patients with dense breast.
There you go. That's a really good, important topic. I want to kind of touch on that because I mentioned breast density before, family history. What are the other risk factors that women should be kind of checking for or familiar with? Yeah,
so when it comes to risk factors, age can definitely play a role. So we start to see an increased risk of breast cancer above the age of 65, but it doesn't mean you should wait until 65 to start screening because we want to capture it when it's small and it hasn't spread anywhere else. Other risk factors, in addition to dense breast, family history, is having the BRCA gene. However, that's where we can help determine, okay, are you at risk of having that gene? And that's also based off of family history. Another risk factor, like one of the highest risk factors for breast cancer is, for example, if you've had a history of exposure to chest radiation. However, that is particularly seen more if you've had that during childhood, so in our patients who have battled with pediatric cancer.
Okay, good to know. I'm like really into the conversation. I'm like getting lost in what you're saying. So the demographics here, I know CBS News actually did a story not too long ago that black women are more diagnosed and more likely to die from breast cancer compared to their white counterparts. What are the other demographics of those kinds of statistics when we're talking about risk factors? Yeah,
definitely. So yes. So unfortunately, you're correct. And our black female patients, they have the highest risk of breast cancer related death. Whereas in our white females, they have the highest risk of being diagnosed with breast cancer. And then in our Hispanic community, the most common cause of cancer related death in our Hispanic females is breast cancer. The big reason as to why we're seeing that large disparity is due to the health disparity. So for example, if a patient doesn't have access to a primary care provider or a gynecologist, or there's long wait times, or the clinic is far to get to, the time from when they get in to get the screening, there's a delay. And then they can also have difficulty getting transport to the imaging center. And then once they're diagnosed, that can cause a further delay just getting into the specialist.
And it might sound simple to someone at home who has a working car or the finances to go and get, pay those copays at the doctor. But for someone who is not in a position, those are true challenges to overcome, right?
Yes, definitely. And one thing that I recommend our patients, if, for example, you lose your insurance, there are resources out there for patients who don't have insurance as well. And if you have a family medicine provider, internal medicine, primary care, gynecologist, ask them about screening. And it's important to advocate for yourself too.
That's really important. And also the mobile mammography units. If you can't get to them, they can get to you.
Yes.
Thank you so much, Dr. Jennifer Moreira from Baylor Scott & White. We appreciate you being with us.
Thank you for having me.